Hello, I'm Clarissa Brown-Douglas, one of the nutritionists at Kentucky Equine Research. One of the most common requests we get from horse owners is how to feed a horse that's susceptible to laminitis. Well, laminitis is a word that does strike fear in horse owners. It's a really debilitating condition, and it's a condition that can happen seemingly overnight. Laminitis is a disruption of the blood supply to the feet. It's usually caused by an inflammatory condition, and it's incredibly serious, it's incredibly painful and debilitating for the horse. By far, the most common cause is due to an insulin dysregulation or a hormonal condition, and it's usually brought on by lush pastures or high grain diets. So these horses that have an insulin dysregulation will often suffer from metabolic conditions such as equine metabolic syndrome or PPID, otherwise known as Cushing's disease. So horses with these metabolic conditions will usually be overweight and they will usually be underworked. They'll have fatty deposits throughout the body, including a cresty neck, which you can see here on my beautiful model Heidi, and fat deposits often around the tail head. So you can see just at the top of her tail there's a few little areas of adipose tissue that we would like to see reduced ever so slightly. So triggers for a laminitic episode in these horses which are suffering from insulin dysregulation are grazing lush pastures and access to high sugar feeds such as cereal grains. These particular horses, when they consume a high sugar diet, will have unusually high levels of circulating insulin, and it's thought that that circulating insulin will cause inflammation and dysregulation of blood flow to the blood supply in the hoof. So it goes without saying, because laminitis is so painful, it's really important to prevent this condition from occurring. So it's important that these horses are provided with a diet that they're able to function as our riding friends, but we don't want to tip them over the edge in terms of having this condition. So diets will often need a complete overhaul if one does have a laminitic susceptible horse. So the number one rule with feeding a horse with laminitis is do not starve them. It's an old school form of thought that you would lock the horse up and not provide it with any feed, and although in the short term that may help because it'll stop the horse receiving any blood sugars, it's not safe at all, and in fact it can lead to secondary problems such as gastric ulcers and nutrient deficiencies, etc. So it's really important to have your diet analysed, make sure that you've got a nutritionist working with you to form the best possible diet. So how do we deal if you have gone out into the paddock and your horse has been fine the night before and the next morning it's standing in that terrible sawhorse stance, suffering from a bout of laminitis? Well, the first thing that you must do is call the vet, and the vet is needed to provide anti-inflammatories and pain relief and to help you with the management of that horse. But you must also remove it immediately from the pasture and provide it with some low sugar forages to keep its gut going. And when I say a low sugar forage, I mean a hay that has been tested to have a non-structural carbohydrate level of less than 10%. So ask your hay supplier to have the hay tested, and when you're reading that hay analysis, look down onto the dry matter column and look at your starch levels and your water-soluble carbohydrate levels. You add those two together, and if they're less than 10%, you're on the right track. It's important though that diet's not actually balanced, because hay has a lower level of essential vitamins and it's low in trace minerals and often low in protein, and so these horses still need to be provided with a balanced diet. Therefore we recommend a low intake vitamin mineral supplement or feed balancer, provided it's been formulated to be low in non-structural carbohydrates. Another way that we can feed these horses is providing them with low sugar chaff and beet pulp. So once your horse has recovered from its acute bout of laminitis, it's really important to prevent it happening again. So the idea is to limit access to sugary roughages and limit access to cereal grains. So if these horses, which are usually obese, we've got to keep the feed going into them but the calories low. Again, your tested hay that's less than 10% non-structural carbohydrates is important to form the basis of your diet. You want to limit access to pasture, and you want to feed this vitamin mineral supplement that's balancing that diet off. again, avoiding pasture, avoiding cereal grains is vital. So there's situations where horses aren't obese that still are at risk of laminitis. A lot of your sport horses or horses suffering from Cushing's disease will often be underweight and under-muscled. These horses still require a low NSC diet, but they need more calories. So these calories can be provided with feeds containing high levels of fat and digestible fibre, and you can top up the calories in the diet with ingredients such as oil, stabilised rice bran or beet pulp. Again, a low sugar roughage should form the basis of these horses' diets. One of the rules of thumbs that you'll come across with laminitic horses is you'll always hear this magical number of feed a feed that's less than 10% NSC or non-structural carbohydrates. Now remember that that is the NSC of the total diet, not just the feed. So I often hear feeds or supplements being disregarded in terms of being suitable for laminitis because the ingredient list might mention molasses or say grain byproducts. Some of these won't be suitable, but many of them will be because a very small amount of these ingredients are included for palatability reasons, but because you're feeding such a tiny amount of them to the horse and the amount in the feed is very small, they are safe when you take it in as the diet, as part of a diet as the whole. For example, 500 grams of a typical feed balancer that might be formulated with a little bit of molasses and a little bit of grain byproducts to hold the pellet together. So maybe coming in at an NSC of say 15%, fed with over 5 kilos of a low sugar hay measured at say 8% NSC. The total diet is over 5.5 kilos per day, but the NSC averages out at under 9%, so still within a safe zone for many horses. For those requiring a little bit more nutrition, so the skinnier horses, feeding a high fat and fibre feed at its recommended amount, say 2 or 3 kilos a day for a 500 kilo horse, plus 5 to 7 kilos of a low sugar roughage, you're still coming in at under 10 or under 12 at least percent NSC, so it's still within a safe zone. So it's important, ask the feed company or the supplement company what the NSC value of their feed is, because the small amount being fed probably will be negligible when it comes to the total diet NSC. Let's have a talk about pasture. I'm surrounded by the most beautiful pasture here in central Victoria, and a lot of horse owners have access to pasture. It does provide the basis of many horses' diets, but it's a really tricky one when it comes to laminitis. It's impossible to look at pasture and know whether it's going to be safe for your laminitic horse. Some pastures can appear to be safe in terms of being brown or dried out, but you really can't tell unless these pastures are tested. So don't rely on what you see. Treat all pasture as slightly concerning. So the other issue with pasture is a lot of people say, well, I've had a pasture test, and that's fabulous. However, pasture can change composition within a matter of a few hours. So what might be measured at low sugar in the morning, by the space of the late afternoon is high in sugar and at dangerously high levels for a susceptible horse. The other times that we see concerns is when pasture's under stress. So pasture that's in a drought environment or an environment where we've got frosts at night also is a concern. Spring and autumn is when we see laminitis occur, and this is because they have longer, warmer days but cooler nights. So in the daylight hours, pasture is producing sugars for growth, and usually in normal conditions that the pasture's growing and it's using those sugars, and so it's a time when it might be safe for the horse. But in times under stress, so as I said, drought or changes in the season, cold nights, warm days, those sugars are not being used by the plant. They're essentially storing them in a hope that the environment will change and they can grow. If a horse consumes these sugars, that's when we run into problems. So when is the safe time to graze pasture? Well, ideally not in times where the season is changing, and allowing the horse access very early in the morning to about mid-morning is probably going to be when sugars are at their lowest. But again, if you're unsure, don't put the horse on the pasture. Hopefully I've helped you with how to manage horses that are susceptible to laminitis. It's important, number one rule, never starve a horse That's right, isn't it, Heidi? Never starve a horse that has laminitis. You still have to provide them with the nutrition to perform their daily functions. Certainly if they've experienced an inflammatory condition, they need that nutrition to grow healthy hoof and to perform at their best. So I wish you all the luck when it comes to spring. Remember to keep your eye on that pasture and remove them if you think they're going to be at risk.